Wildfires can affect air quality. This is true even when a wildfire is not close by. This video will help agricultural workers learn how wildfire smoke can impact their health and how to avoid and reduce exposure to wildfire smoke on the job and at home. During a wildfire, the air becomes dark and it has a strong smell. This is because the air is full of harmful chemicals and particles from the things being burned: trees, vegetation, structures, and everything else in the fire's path. The smoke particles in the air are very small, smaller than the diameter of a human hair. We know they are there because the air changes color, but we are not able to distinguish each of the particles with our eyes. The size of the particles is important because those that are very small, called PM 2.5, can enter our blood through the lungs and affect our health. During a wildfire event, you may experience health impacts such as burning eyes, runny nose, chest pain, fatigue, coughing, wheezing, difficulty breathing, worsening of asthma, or a rapid heartbeat. Wildfire smoke can negatively impact everyone, but some people have a higher risk of experiencing symptoms, such as older people, pregnant women, people with heart and lung problems, and people with asthma, diabetes, or chronic bronchitis. Air quality is reported to the public using a scale called the Air Quality Index, or AQI. There are different categories in this scale, from good to hazardous, based on how polluted the air is and who is most likely to be affected. You can look up the AQI on your phone or mobile device at airnow.gov. During a wildfire event, your supervisor should monitor the AQI. The air is considered unhealthy when the AQI reaches 151, the unhealthy level, or red in this chart. This is the point when you need to take action to protect your health. You may fall in the sensitive group category, especially if you have a condition like asthma or diabetes. If that's the case, you will need to take action at a lower AQI. Regardless of the AQI, tell your supervisor if you begin to feel sick or have difficulty breathing. When you check the AQI, you may notice that many locations, especially rural locations, are not near an AQI monitor. Due to variations in weather and landscapes, the AQI at the monitor location nearest you may not accurately reflect the air quality where you are. If this is the case, you can utilize visibility to approximate the AQI and determine your action level. Public health and air quality monitoring agencies recommend taking action when visibility is reduced to 5 miles. The first thing to consider when the air quality reaches an action level is if your tasks can be delayed, rearranged, or altered to avoid being outside. Ask your supervisor for guidance on changing any of your work tasks. When air quality is poor on days you are not working, limit your outdoor activities, especially strenuous exercises like playing sports, running, or biking. Unfortunately, because you have to care for animals or complete time-sensitive planting or harvesting tasks, you may not be able to go inside and avoid wildfire smoke. When this is the case, your next best protection is to wear an N95 respirator to filter the air and reduce the number of particles you breathe in. An N95 respirator, also called a filtering facepiece respirator, is made of filtering material able to stop some of the small particles in wildfire smoke. Surgical masks, bandanas, and cloth face coverings will not stop the small particles because the weave of the fabric is too large. Even a bandana folded 2 or more times does not protect you from wildfire smoke particles. Ask your supervisor for an N95 when the air quality index reaches 151 or sooner if you begin to feel sick because of wildfire smoke. The use of a respirator is voluntary, but it is encouraged to reduce your risk of being affected by the smoke while working. You may need time to adjust to wearing a respirator while working, but it is important to use it to reduce the amount of harmful particles that you breathe in. An N95 also provides protection from COVID-19. While wearing an N95, you do not need to wear any other face coverings to prevent the spread of the virus. To be effective, an N95 needs to be put on and worn properly. The end of this video includes a demonstration on how to properly put on and check the seal of an N95. These respirators are intended to be disposable, and they should be thrown away after 8 hours of use or sooner if the mask becomes dirty, wet, or difficult to breathe through. Do not share your N95. Facial hair, scars, and acne can affect the ability to create a seal. During wildfire season, consider keeping your facial hair trimmed so that it will fit inside the respirator seal. Wearing a respirator will reduce your risk, but you still need to pay attention to how you feel. Report smoke-related symptoms and let your supervisor know if you feel the air quality is worsening. When the air quality reaches an action level, you should also take steps to prevent the smoke particles from entering indoor spaces. This means closing windows and running the fan of your furnace or air conditioning unit continuously. Install a high-efficiency filter on your fan and replace it more frequently, once a month, during wildfire season. HEPA-certified portable air cleaners can also be used indoors, but you should avoid electrostatic air cleaners. Now we will demonstrate how to properly put on and check the seal of an N95 respirator. Remember to always wash your hands before putting on and after taking off any personal protective equipment. To put on an N95, cup it in your hand with the straps hanging down. Place the mask over your nose and mouth with the metal nose clip on top. Pull the top strap over your head so that it rests on the crown of your head above your ears. Then, pull the bottom strap over your head until it rests just below your ears. Some masks allow you to tighten the straps by pulling on the free end of the strap where it meets the mask. Using both hands, starting at the top, mold the metal nose clip around your nose to achieve a secure seal. To make sure the N95 is on properly, you will need to conduct seal checks every time you wear a mask. You also want to conduct seal checks whenever you adjust the mask on your face. To conduct a positive pressure seal check, place both hands completely over the respirator and exhale. The respirator should bulge slightly, and you should not feel any air escape around the seal. If air does escape, readjust the respirator on your face. Make sure the metal nose clip is contoured firmly to the shape of your nose, and check again. To conduct a negative pressure seal check, place both hands over the respirator and inhale quickly. The respirator should collapse slightly. If air leaks between the face and the seal of the respirator, readjust and check again. If you don't pass both of these seal checks, you are not protected. Remember, always wash your hands before putting on and after taking off a respirator. This video was produced by the High Plains Intermountain Center for Agricultural Health and Safety at Colorado State University, with collaboration from several regional partners. Special thanks to the Western Center for Agricultural Health and Safety at the University of California, Davis.